This is the Daily Medical News by MD Edge, where we bring you the top stories in clinical medicine, followed by a deeper dive into the day's top story. Today is Monday, November 25th. I'm the voice of MD Edge podcast, Nick Andrews. And of course, all of the stories you hear today are available in full written form at mdedge.com, and you can find links to the individual stories in the show notes. Coming up later, we'll take a look at the usage of marijuana and CBD among patients with endometriosis. But first, we'd like to ask for your help in making this podcast a little better. If you haven't already, please take a moment to complete our short listener survey following a link in the show notes. The questions include a little bit about you and what you like, what kind of podcasts you like. We greatly appreciate it, and of course, the survey is anonymous. And now, the top stories in clinical medicine. We begin today with our continuing coverage of the 2019 annual scientific sessions of the American Heart Association in Philadelphia. Treating patients to a lower LDL target following an ischemic stroke resulted in fewer recurrent strokes or major cardiovascular events compared with those in a higher LDL goal. This comes despite the international trial being halted due to the lack of funding. In the study, researchers showed that the group of patients with an atherosclerotic stroke who achieved an LDL cholesterol of less than 70 had 22% less recurrent ischemic stroke or other major vascular events compared with a group who achieved LDL between 90 and 110. The data were also published online in the New England Journal of Medicine when they were presented at AHA 2019. Dr. Mitchell Elkind is the president-elect of the American Heart Association. He called the results practice confirming of a strategy that many cardiologists already follow for stroke patients. And geriatric patients who are hospitalized for IBD or irritable bowel disease have a sharp increase in mortality. Those patients who are 75 years old or older have a 4 to 5 times greater risk of inpatient mortality compared with younger patients who are hospitalized for IBD. This is according to new research presented at the 2019 annual meeting of the American College of Gastroenterology. That meeting was in San Antonio. In their presentation, the researchers noted that the magnitude of this finding was much larger than the differential inpatient mortality between geriatric and non-geriatric patients who had been hospitalized for conditions other than IBD. Researchers used the National Inpatient Sample for 2016, which is a representative sample comprising of 20% of all U.S. hospital discharges for that year. The study population includes 71,040 patients who were hospitalized for acute management of Crohn's disease or an immediate complication. The researchers report that inpatient mortality in geriatric patients was 1.5% compared with 0.2% in non-geriatric patients. They also found that the inpatient mortality rate in geriatric patients with ulcerative colitis was 1% in patients 75 or older compared with 0.1% in those younger than 75. And the 9-valent HPV vaccine carries an extremely low rate of adverse events, and most of those cannot be definitively tied to the vaccine. This is according to 2 large studies that were published simultaneously in pediatrics. The new data further bolster evidence on the vaccine, which was approved back in 2015. One of the studies is called Vaccine Safety Data Link, and it included nearly 840,000 doses. The study looked for safety signals in a pre-specified group of potential events, including anaphylaxis, appendicitis, Guillain-Barré syndrome, chronic inflammatory demyelinating polyneuropathy, pancreatitis, seizures, stroke, and VTE. The analysis found potential safety signals in allergic reactions, appendicitis, pancreatitis, and syncope. However, none of these were confirmed after further investigation. You can read more about this trial as well as the other analysis, which is called VIRES analysis, by clicking the link in the podcast notes. The Daily Medical News will be right back after this. Welcome back to the Daily Medical News. I am Nick Andrews. Earlier onset of atopic dermatitis in children could signify more difficult to control as well as persistent disease. This is according to a new study published in the Journal of the American Academy of Dermatology. In this observational study, more than 8,000 patients with childhood onset atopic dermatitis were assessed twice yearly for up to 10 years. More than 70% of the patients had early onset atopic derm, which was defined as onset occurring before the age of 2 years. Those between 3 and 7 years onset had mid-onset disease, and late onset was defined as those acquiring the disease at 8 to 17 years old. The report that older age of onset was associated with better control. The results showed that for each additional year of age at onset, there was a 7% reduction in the odds of poorer control of the disease. Those who had mid-onset disease had a 29% lower odds of poorer control compared with those with early onset, while those with late onset disease had a 49% lower odds of poorer control. The likelihood of atopic dermatitis persisting beyond childhood also appeared to be linked with the age of onset. Those with mid-onset disease had a 55% lower odds of persistent atopic dermatitis, and those with late onset had 81% lower odds compared with those with early onset disease. The researchers noted that there is considerable research that is currently focused on identifying atopic dermatitis phenotypes and endotypes, and that these data on disease course for early, mid, and late onset disease support the idea of disease subtypes for atopic dermatitis. And finally today, marijuana and CBD use is common among patients with pelvic pain from endometriosis. In fact, more than 1/3 reported past or current use, according to the results of a new survey. Dr. Anna Reinert is an OB-GYN at the University of Southern California in Los Angeles. She presented data at the 2019 Global Congress of the American Academy of Gynecologic Laparoscopists in Vancouver. Dr. Reiner said that these findings come as more and more companies are marketing CBD-containing products to women with unsubstantiated claims about efficacy. Dr. Reiner and her colleagues examined use patterns by creating a questionnaire with about 55 to 75 questions, which followed a branching logic tree. The topics included pain history, demographics, and experience with marijuana and CBD for the purpose of controlling pelvic pain. The researchers sent the survey to 2 groups: an Endometriosis Association mailing list, and patients at a chronic pain center in Phoenix. The researchers analyzed results for 366 completed surveys out of more than 24,000 surveys that were sent out. Dr. Reiner cited marijuana stigma as a reason for low response rate. Overall, the researchers found that 63% of respondents said they had ever used marijuana, and 65% said they'd ever used CBD. Of the 37% of respondents who reported marijuana use, 45% of those reported that its use was very effective, while 1/4 said it was moderately effective. 22% of CBD users said it was very effective, and about 33% said CBD was moderately effective. According to Dr. Reiner, these data suggest a need for more research into potential benefit and the potential limitations of cannabis for pelvic pain from endometriosis. Until this study, efficacy evidence for marijuana for this specific indication has been sparse. A report from the National Academy of Sciences showed that there is evidence that cannabis and cannabinoids have a therapeutic effect on chronic pain in adults, but that report did not mention gynecological applications. Despite the lack of evidence, surveys have shown that women of reproductive age use marijuana, and 13% of women and 19% of men in a pain management population tested positive for marijuana, according to a report by the Ameritox Laboratory. Despite the lack of research, companies are still developing CBD vaginal suppositories and marketing them for menstrual pelvic discomfort, pain during sex, and other issues. The lay press articles often boost these claims, although some skeptical takes address the lack of evidence. Still, Dr. Reiner says these articles are still more positive than they're not. This press leads to a lot of interest among patients in using marijuana or CBD for symptom relief. This is part of the reason that Dr. Reiner and her team decided to examine use patterns and its perceived efficacy. Another reason, she said, is that there is some biological basis to believe that cannabis could be helpful. There is some evidence that women with endometriosis have changes in their endocannabinoid system, and that there are clinical trials examining the impact of non-CBD, non-THC cannabinoid ligands. And that concludes this edition of the Daily Medical News. Remember, you can read any of the stories you heard today by clicking the links that are available in the podcast notes. For MD Edge, I'm Nick Andrews.